Cronin Toyota and Cronin Nissan are honored to partner with Proudly We Served, as well as the continued support of our local active and retired military veterans across eastern Indiana.
I'm Al Bledsoe, Veterans of Foreign War, Post 1108.
I'm Ron Chappell, chaplain for Vietnam Veterans Post Chapter 777 here in Richmond, and co-host here with Al at Proudly We Served. Our guest this morning, Joseph.
Hello.
DeVito.
I'm Joe DeVito.
Yeah.
I'm the Outreach Director for Indiana Department of Veterans Affairs.
And does a heck of a job, I'm telling you. This guy,
just all over. So let's talk about VA healthcare.
Right on. So one of the things I definitely want to say is the VA encourages, and I strongly agree, to have every veteran enroll in VA healthcare that's possible. There's a lot of veterans out there who we encounter at all different outreach events, and we talk to them, and you know, I'd say I don't need to enroll in VA healthcare. I don't want to take away from another veteran. I have insurance on the outside, or other reasons that they don't think they should enroll. So what I want to say is that's not the best. Please enroll.
Yeah.
Enroll.
That's old business.
And I want to say that because there's a couple things to know. If a veteran has insurance from a workplace or whatever else, they have outside insurance. That doesn't mean that they can't enroll in VA healthcare. That doesn't mean if they enroll in VA healthcare, they can't use their other insurance. So really the way it would work is if a veteran enrolls in VA healthcare and they have an outside policy, a couple things will happen. The VA would only ask that that veteran comes 2 times a year for their blood work, right? Go in, get your blood work, get your labs, and you're out.
Okay.
If you want to use your other doctor, you have another doctor from your policy that you have on the outside, you want to continue to use that, VA is completely fine with that, and that's no problem. Some of the advantages of not just doing that, but having that VA as well, is first off, prescriptions through the VA are far less money than from the outside.
Right.
So if you use your outside doctor, we tell veterans, just tell them to share with your VA clinic doctor your records and other things. This way, if you get a prescription on the outside, you can go to your VA doctor. They can look at the records, be like, yes, you do need this medication, and then you can see how much less expensive it might be, and VA can fulfill that prescription. So
Yeah, like free.
absolutely.
When I was in the hospital, it's been a couple months. So the nurse is giving me this medicine, and she said, you know, we can fill the prescription. I said, well, I'll just have the VA fill it, because I always insist they use VA facilities or whatever.
Yeah.
And so she started this. Well, we had a veteran in here last week, and he couldn't get his medicine and just went on and on. I said, wait a minute, stop. Tell that veteran to look in the mirror. Because sometimes it's me, it's not them. So, and a lot of the times, because I mean, if I order medicine, even in the hospital, if they order it, I get it the next day at home. So the VA to me is just spot on with stuff like that. I mean, or with me, I guess I got to qualify.
Well, what if now we happen to have a very active military base right here in Dayton, the Wright-Patterson, and they honor and provide service to veterans as well. So if a veteran chooses to go there, how does that work with VA? I mean, do they share?
Well, the VA, you know, any provider outside of VA, there's definitely a good continuity there at most points. I have TRICARE, which is a retired
Right,
Yeah.
I've got that.
insurance as well, which I don't really use because I enjoy my VA healthcare better. The folks at the clinic here in Richmond are amazing. That's attached to the
Yeah.
VA in Dayton. It's interesting, Indiana has
Oh.
8 different VA medical centers that work with Indiana veterans, and only 2 of those medical centers are in Indiana.
I thought they were attached to Dayton.
So
The guys here
Richmond
in
is part of Dayton. Yep, Richmond.
Okay.
So the Richmond clinic is from the Dayton hospital.
Okay.
You know, we have the hospitals serving Indiana are Dayton, Cincinnati, Ohio, Louisville, Kentucky, Danville, Illinois. Oh, there's one I'm missing, West, and then I know Jesse Brown out of Chicago. And then we have VA Indianapolis and VA North in Fort Wayne. So we have a lot of different medical centers, but you know, if a veteran has that, like I said, if they have that outside insurance that they get from their provider, if they do use VA, VA is not, you know, they're not dumb. They're going to bill that outside provider. So if I have a Humana policy, and let's say I have to pay 20%, Humana pays 80%, but I go to the VA clinic because I'm also enrolled in VA healthcare, VA is going to bill Humana for
Okay.
that service. But what they're probably not going to do is bill me the 20%. So I'm saving my deductible
Yeah.
by using that VA.
Right.
And really, in the end, you know, you could wind up needing VA, needing healthcare outside of the area, maybe on vacation or something. You go to a VA hospital if you're enrolled. That's a great opportunity for a better continuum of care.
Yeah.
If you're not at your home base, and really, in the end, if you qualify for VA healthcare, I just think you just should enroll. Get enrolled in VA healthcare because it's something that's there. Of all the things we're talking about, there could be some other good reason for an individual veteran to just be in that healthcare. So it's worth looking into. And in the end, the way it works is the funding for each VA medical center. So here we are in Richmond, that's the Dayton, all the different medical centers across the country.
Right.
Every VA's medical center funding is based on enrollment. So if you have outside insurance
yeah,
and
they
you want to
got
use
that,
your outside
yeah.
insurance, but you qualify for VA and you want to help fellow veterans,
Right.
enroll.
Right.
Because if you
That's a
enroll,
good point.
you're bringing money in because you're now an enrollee.
Yeah.
And that's more money that goes into your medical center. So
Somebody
That's a good
gave
point.
me. Somebody had those figures with stakeholders. That was brought up in a meeting of how much income one veteran brings when they're in the medical part of it, and just, I mean, the whole ball of wax. How much money is actually involved there? I didn't realize though that really helped them grow if a young man enters into the health. That's interesting.
So
Yeah,
if I
that's-
don't use it,
Huh?
so even if I don't use it, I should enroll. If I'm,
Yep.
I'm getting service somewhere
At
else.
least enroll in it. Yeah,
Yeah.
that's what he's saying. If you
Yeah.
enroll in it,
And the potential is there that I may need it, like you said, especially you're traveling. And
exactly. Yeah, I
Absolutely.
can
And
see that.
And you might just wind up realizing that you like it. Interestingly, John Bursler from the Veterans Experience Office was at the last at NASDVA, was presenting a few things, and every year they present a lot of their statistics. And you know, that whole Veteran Experience Office out of Washington D.C. is basically there to measure and curate every veteran's experience with the VA. No
Wow.
matter what every point of contact, they want to evaluate and they want to make it better. But what's you know, amazing to me is our government-run VA healthcare system has got, it's in the 90s, above 95% approval rate by users, which is unbelievable.
Yeah. Gee.
If you look at any other healthcare setup that we have right now, no one's even close
Hey, that's
to
a
that.
far cry from 15, 20 years ago. I mean, really.
Absolutely. You know, the VA it's really dedicated itself to giving the best care they can. And I know everybody has their own unique experiences, but if anybody's concept of VA healthcare and the VA system is based on anything prior to 5 or 8 years ago, definitely
Yeah.
try it out again
it,
because
yeah.
it's definitely a different experience. I mean, we both go to the Richmond clinic here, and like I said, I choose my VA. I don't have to use VA.
Right.
I've got TRICARE. I could go elsewhere, but
Right.
you know, I really like my clinic. I like the care that I get at the VA.
Sure.
And all the medical centers are.
Well, I
Yeah.
think they've just done, you know, I go to Kettering for stuff. That's a VA referral. But they really treat you as good as I think possible. But the guy that's actually my doctor at Kettering is a retired Air Force guy. So, but he's really good. But case in point was I had to have a shot, or I have to get a shot. I haven't got the shot yet, but I'm going to. They said, what do you want to do? And I said, well, if the VA can give the shot, I'll let the VA do the shot. Well, he wanted to do the shot, and he carries quite a bit of clout with Wright Patterson, because he used to be the head of neurology, right? So he carries a lot of clout with him. So I said, okay, whatever. So the VA called and said, do you want to do this shot in Richmond, or do you want to do it in Dayton? I said, well, it makes no difference. Whoever's going to do it. And they actually just called me last week and wanted to know if I wanted to have the shot done at Kettering or at the VA. And I keep telling them it doesn't make any difference. Well, the doctor won that battle because I'm going to get the shot at Kettering. But
Right
for
on.
some reason, he wanted his doctor to do it. Who knows about that? But they are highly
Funding.
involved in that. I mean, it really surprised me how much communication must go on.
You know, that's a great point too, as the efforts. So you know, a few years back, there was a real expansion of community care, and the VA's program. That's actually been around for a very long time, but it's never worked real well. But right now, you know, it's better than it's ever been. And
Oh yeah, it's working. To me, it's working just
Absolutely.
about as
And
good
the
as
way-
it can be.
Yeah, and it's very simple. If you're enrolled in VA healthcare, and either by time or by facility or by specialist, the VA can't provide care. So if you need a specific, you need to be looked at by a specialist, or if the VA has that specialist, but they can't fit you in a reasonable time window, usually it's 30 days or less, then they can authorize you to go to community care. Also, if VA doesn't offer that specialty, you know, then they can authorize you to go to community care, which is a whole network of private and community physicians, clinics, and others who are part of the system. You can just go make the appointment there. It's very smooth, no paperwork, no billing. VA takes care of the charge. And so it's a great program.
Have you ever met Dr. And I'm going to say her name is Petrioni, and maybe that's wrong. She's the head of vascular surgery in Dayton. So I had an experience that had to be dealt with, and out of nowhere, I mean, I'd heard of her because she had did some work on a couple of the guys, but I didn't know her, and out of nowhere, I got a phone call from her. And she said, I looked at your CAT scan, and I don't want you to do anything till I look at it a little bit longer. I said, okay. So the next day she called me, and I was so surprised because she's the head of vascular surgery at the Dayton VA. So it's not like I'm not the only patient she's got. So how in the world could she corner that much time and take the time to call me? And then she said, you know, I'm just calling you to tell you I can't do it, but I got somebody that can.
She's probably got other doctors working under her.
So
But
she
to your
set
point,
up
though,
the appointment with
Yeah.
with IU.
Yeah.
So that kind of, and she's called me since then, just last week. Wanted to know, and I thought, how in the world's that lady? But I'm sure she's got some kind of a little prompt system on her computer. But she called and wanted to make sure I was all right, and she said, I see you're going to go to IU the 30th.
Yep.
And so she knew all of that stuff, even though I never.
It's
said
really,
anything.
it's
amazing to me.
It's great that just, you know, some of the folks that we've seen when I go to these different opportunities we have for conventions and other things. And, you know, the VA's invested a lot of money into this system of when you call the VA, they now, whoever you're talking to on the phone can see all available appointments
Yeah.
everywhere
Yeah.
for you and schedule you.
Right.
Yeah.
You know, I could be talking to someone in Dayton. They could schedule me for a procedure at Jesse Brown VA Medical Center
Yeah.
in Chicago. That moment, they can see all the availabilities. It's really an impressive system.
Wow.
It's amazing how they do that. I just can't. I had that experience just last week. I was talking to the doctor on the phone, and he just kept going over, yeah, I see that, and I'm thinking, how in the world do they, even though, I mean, I understand computers and all that stuff, they
Right.
must have it wired, or they just,
But there's another group, guys, that we need to be concerned with, at least I think. What about our spouses? How can they get service through VA?
They cannot.
They cannot.
So VA healthcare is for the veteran.
Only.
Veteran only. Now, there is some opportunities, TRICARE, which is
Yeah, I'm familiar
retired.
with that, yeah.
So if you're retired from the military,
Yeah.
TRICARE is for the veteran and also their
Yeah, my
dependents.
wife has tried here.
Yep. And then the only other one would be CHAMP VA,
Uh-huh.
which is a program that's available to spouses and dependents. When I say spouses, I mean dependents. So a spouse is a dependent and a child is a dependent of a veteran until the child turns 18, unless the child's enrolled in full-time college or university or education program, then they will stay a dependent until they either graduate or turn 26, I believe.
wow.
Or if that dependent child is deemed permanently disabled prior to the age of 18, they will stay a dependent for the entirety of their life with the veteran as well. So
Wow.
that's a dependent. And then CHAMP VA would cover veterans who are 100% service-connected disabled. Then their dependents would get CHAMP VA.
So they can go into a VA medical
Actually,
facility
CHAMP
with
VA
CHAMP
is
VA?
any medical facility. It's just
Is that right?
it's like insurance. They can go to any doctor, yeah,
Wow.
with CHAMP VA.
So how do they apply for that? How do they get that?
They will be notified if, say, the veteran hits that 100% service-connected disabled, or the permanent 100%, and then that's an application that goes to Denver, Colorado, is where CHAMP VA is. The other interesting part about that too is something I just want to hit on if we have a minute
Yeah.
Sure.
to shift. And you know, we all saw the PAC Act come out a while back,
Yeah.
which is an amazing expansion of presumptive disorders for exposures and service. So, you know, that's Vietnam and Agent Orange is one of the ones we hear about a lot, but and burn pits.
Yes.
So this is for any veteran at Camp Lejeune, anyone who had an exposure, a toxic exposure while serving in service. When you file for a service-connected disability with the VA, you're saying this problem was caused by my service. I'd like to file a claim. At that point, it's on the veteran to prove what I have now was caused by my service. Either
Yeah.
I got out last year or I got out 20 years ago.
Okay.
So presumptive disorders eliminate that need to prove anything. It's presumed. So in Agent Orange, if you served in Vietnam,
There.
then they presume you were exposed. And then now what we have is the list of presumptive disorders. So for Agent Orange exposure, there's unfortunately a long list of disabilities, diseases, and disorders associated with that exposure. For example, type 2 diabetes. So if someone's DD-214 shows I served boots on the ground in Vietnam between these dates, that was then. And look here, my doctor, I got a diagnosis of type 2 diabetes. That connection is presumed, and that veteran will be service-connected disabled for type 2 diabetes. Now, the severity of the condition will determine the level of compensation that that veteran receives. But what that is that's a presumption. So they make that presumption. So one of the things that the PAC Act did was it expanded for burn pits, for Agent Orange, all of those presumptive disorders, and you put more on the list is what it did. Which is a great thing for all of our veterans. So you know, anybody, if you even think you have an exposure, find your county veteran service officer at our website in.gov/DVA, and go talk to them about that. But one of the things that I think is important when we're talking about our dependents is, what's interesting is there's a specific VA benefit for a surviving spouse and or dependents called Dependency Indemnity Compensation, DIC. I'm going to say that from now on, DIC. So that claim is for those surviving spouse or dependents can qualify in three ways. The first is that the service member died while serving on active duty. That's something the DoD takes care of, and that's service members on active duty. The second way is if the veteran was receiving 100% service-connected disabled compensation from the VA, total and permanent, for 10 years or longer. So if they were receiving 100% for hearing loss, for back, for whatever issues, a combination of issues, if they're at 100% total and permanent for 10 years or longer, then the surviving spouse and dependents would qualify for dependency indemnity compensation.
Will she continue to draw his compensation?
No,
Okay.
they don't. And that's one thing, that's a great point. Federal service-connected disability compensation benefits end with the veteran. They do not continue on to surviving spouses or dependents. So that was the two ways. The third way is if the veteran's cause of death or a contributing cause of death, basically on the death certificate, was a service-connected disability. So if a veteran was service-connected for ischemic heart disease, and he has a massive cardiac failure to cause his death or her death, that's a service-connected cause of death that qualifies that surviving spouse or dependents for the DIC.
Right.
So the trick is, what people need to know is, with presumptive disorders, presumptive is presumptive. So the Vietnam veteran, served boots on the ground in Vietnam, gets lung cancer 30 years later, diagnosed with lung cancer. Lung cancer's on the list. So, served in Vietnam, now has lung cancer, gets a service-connected disability rating for lung cancer,
Okay.
right? So that veteran maybe passes away from lung cancer, or is a contributing factor was the lung cancer. That qualifies that surviving spouse for the DIC. But let's say that Vietnam veteran left Vietnam, got home, discharged from service, and never talked to the VA again. Never did a thing for 25, 30 years. Never did a thing.
Right.
Gets lung cancer, doesn't know what a claim is, has lung cancer, passes away. Never filed that claim. That surviving spouse is eligible for DIC because we can presume it.
Right.
If the veteran's cause of death says lung cancer, and we can show the veteran served in Vietnam,
Right. Right.
then we can presume he should have been
Right.
service-connected for
Right.
that,
Wow.
which would qualify that surviving spouse. And I
Right.
think it's so important. I want to let folks
That's
know
great. That's great.
right now, because if we look at the age of our Vietnam veterans and their surviving spouses, the DIC, now that will be suspended if the surviving spouse remarries. So it doesn't get canceled, it gets suspended. So if a surviving spouse is collecting DIC and then remarries, it gets suspended. But that's only up to the age of 53. After 53, even if remarried, we'll start collecting again.
Oh, wow.
So I don't know of one surviving Vietnam spouse that's probably under 53 right now. So that's not really a factor to think about.
Right.
And then if you think about how many veterans, like I said, never filed a claim with VA and have passed away
Right.
from one of these factors on
Right.
this large list of presumptive disorders. So there's quite a few surviving spouses right now
That qualify.
who qualify for this and don't know.
Yeah.
So if you
Wow.
have a relative, as
Man.
you or anybody who was
That's
married to a
huge.
Vietnam veteran,
Okay.
and you were married when that veteran passed away,
Right. Right.
gather that death certificate, find your county veteran service officer,
Right.
and see for this opportunity. And really, in the end, what the DIC comes down to is there's two great benefits of it. One is monetary. So it's, depending on situations, probably $1,500 to $1,700 a month tax-free, deposited into the surviving spouse's bank account, plus Champ VA, which is that free health care.
Wow, that's great.
So those are two
That
of
is
those.
really something.
You know, something I thought about as we were talking. I remember in Nam, we had 55-gallon drums. They cut them in half, and they filled them with JP4, jet fuel. And we had these makeshift latrines, and we had the 55-gallon drums under there, and it would catch your waste. Well, every so often, that had to be burned. So we were tasked with that responsibility to burn, stir, that stuff. And I'm thinking a lot of our guys probably ain't thinking about that, fellas. You know, that's akin to the burn pit kind of experience.
It sure is.
And we inhaled that stuff, and yeah.
Yep, and jet fuel is an exposure.
Oh man, that JP4, man.
All different. There's a lot of different exposures. Hopefully I'll never have an issue. I have an asbestos exposure on my record from one of the ships I was stationed on. So, they're there, and the best thing to do is learn about it.
Yeah.
All our VA medical centers have registries, so you can go if you're burn pit, Vietnam, Agent Orange. You can go to the VA medical center. You can talk to your clinic, make an appointment, and they will enter you into the registry for that exposure. Do I think they do a few tests on you, and they put you in that system. So that's a good portal into that as well. But
got about a minute and a half, guys.
Yeah.
Yeah.
Okay. Boy, that's really interesting.
Yeah.
Okay, so this has been a really good session. There's a lot of
He always brings it.
yeah. There's so much.
Oh,
you have
man.
so much information that
Yeah,
it's just impossible to
We got-
just
yeah,
collect that in a half
we'll
hour.
just have to have him
I mean,
back
it's
again.
just
do a
not
marathon show.
Yeah, okay.
Yeah.
That sounds good to me. But you know what? Continual update, not
Yeah.
a bad idea.
Not a bad idea.
You know, maybe once a quarter or something like that. I don't
Absolutely.
know.
You know where to find me.
Yeah.
Yeah.
Yeah, because it's constantly changing. This PACT Act has been a big deal with veterans, and I think a lot of our community has gotten some benefits of all
Yeah,
that. So,
yeah.
yeah,
It's
that's been
remarkable.
really good.
Anything significant you want us to know before you head out today?
I do with
Name,
with,
address, and phone number.
with the time of year that we're at.
Yeah.
We have our great Military Family Relief Fund, MFRF, at
Yeah.
IDVA that helps veterans out with emergency financial emergencies. So could be car repairs, furnace. If they meet a couple of qualifying factors, there's an income threshold. And they meet that, we can provide them up to $1,500 or $2,500, I'm sorry, for an emergency expense. So that's a great opportunity for them. And with what we've noticed over time is we have spikes in those applications, and we've narrowed them down to 2 times a year, which is when certain veteran households will not spend money on bills because of other things, and one is back to school and the other is holiday expenses.
Christmas.
Yeah.
So with our holiday season approaching,
Yeah.
we have our holiday program, which is a variation of that program. So veterans in households with children, get to our website, take a look at our Family Relief Fund. And that's right at our website. You can find it right there, MFRF.
Okay. All right. We got to wrap it up, guys. Man.
Thank you, folks.
Right on.
So much information.
Yeah.
So glad to see you.
Yeah.
You be careful out there on
Right on.
travel, man. All right. Hey, folks, we'll see you back again here at Proudly We Serve. Thanks for watching.
Thanks.
Cronin Toyota and Cronin Nissan are honored to partner with Proudly We Served, as well as the continued support of our local active and retired military veterans across eastern Indiana.